You've probably heard the word sociopath a million times, right? In movies, on TV shows, maybe you've even used it to describe a terrible boss or a not-so-great ex. It's this go-to label for someone who seems charming, but also manipulative, and maybe just a little bit dangerous. But what are we really talking about when we use that word? Well, let's get into it.
I bet you have a picture in your head right now. You know, someone who can lie without even flinching, who sees other people as just pawns in their own personal game. It's a super powerful and honestly a pretty scary image that pop culture has just run with.
Okay, but here's the twist. If you were to go to a psychologist, you would never get a formal diagnosis of sociopathy. Why? Because it's not actually an official diagnosis in the world of mental health. It's a pop culture term, not a clinical one.
So, what clinicians and mental health professionals actually diagnose is something called Antisocial Personality Disorder, or ASPD for short. This is the official term from the DSM-5-TR, which is basically the guidebook for mental health pros. And ASPD is all about a consistent, long-term pattern of disregarding social norms and really violating the rights of others.
And this is so important, because these labels, sociopath, psychopath, they carry a ton of stigma. Experts really push for us to focus on specific actions instead of just throwing these labels around. So instead of saying, my ex is a sociopath, it's way more accurate and a lot less stigmatizing to say something like, he consistently lied to me about his whereabouts. See the difference?
Of course, the second you hear sociopath, your brain probably jumps to the next question, okay, but what about psychopath? It's a totally fair question. And while, again, neither one is an official diagnosis, some researchers do kind of draw a line between the two concepts to help understand the different ways ASPD can show up.
So here's how researchers often break it down. The idea of sociopathy is usually tied to behavior that's more impulsive, more erratic, and it's seen as stemming from environmental stuff, like a traumatic childhood. Psychopathy, on the other hand, is often linked to a complete lack of empathy and much more calculated, planned-out actions, which might be tied to biological or genetic factors. But I have to say this again, these are theoretical frameworks to help us understand, not two totally separate official diagnoses.
Okay, so let's put the pop culture terms aside for a minute. What are the actual observable signs that professionals are looking for when they diagnose antisocial personality disorder? Let's break down what this really looks like. So, for a diagnosis, a professional is looking for a long-term pattern of behavior, not just a bad week. It has to include at least 3 of these 7 signs. We're talking about things like constantly breaking the law, chronic lying for personal profit or just for fun, being super impulsive, aggressive, and a real, genuine lack of guilt or remorse for hurting people. It's a pattern that pretty much affects every part of a person's life.
And, getting this diagnosis isn't like taking some online quiz. It's a serious, rigorous process. First, the person has to be at least 18. But, and this is a really key point, they have to show signs of something called conduct disorder before they were 15. That's a childhood condition where a kid persistently violates rules and the rights of others. That history is crucial. And finally, these behaviors can't be explained by another condition like schizophrenia or bipolar disorder.
When you see all these criteria, it kind of leads to that huge age-old question, doesn't it? What causes this? Is someone born this way, or is it something that happens to them? When it comes to ASPD, the answer is, well, it's complicated. And it kind of brings us back to those ideas of sociopathy and psychopathy.
So, in the research world, that term sociopathy is often used to describe antisocial behavior that seems to be learned. Things like severe childhood abuse, trauma, or neglect can play a huge role. The thinking is that if a kid grows up learning the world as a dangerous, hostile place, they might develop survival skills that the rest of society sees as antisocial.
And then, on the flip side, you have the concept of psychopathy, which seems to be linked more to biology. Research has pointed to some pretty interesting potential differences in brain structure and function. Things like less gray matter in certain areas, or differences in the amygdala, which is key for processing emotions. So you have this theoretical split. One is made, and the other is born.
So, with this really complex mix of factors, what does support and treatment even look like for ASPD? This is a tough one, mostly because a lot of people with the disorder don't actually believe anything is wrong with them, so they usually don't go looking for help themselves.
Now, while there's no magic cure for ASPD, that does not mean there's no hope. Therapies like cognitive behavioral therapy, or CBT, can help people learn to spot their destructive thought patterns and learn better ways to behave. Medications can also sometimes help with specific symptoms, like aggression. But, and this is the big one,
All of this really depends on one crucial thing. The person has to be willing to actually do the work.
So if there is one thing you take away from all of this, let it be this. Contrary to the movie villains, people with antisocial personality disorder are not just evil. They are human beings living with a very complex mental health condition. It's often rooted in a combination of genetic predispositions and, a lot of the time, really painful experiences like childhood abuse.
And that leaves us with one last thing to think about. If we can start shifting our language away from these loaded, stigmatizing labels like sociopath and move toward a more accurate understanding of ASPD, well, how could that change our whole perspective? How could changing our words open the door to a more compassionate and maybe even more effective approach to this really difficult human condition? Something to think about. Thanks for joining me on this one.